Have you ever wondered where pain comes from? I get these questions all the time. Evan, how did I get this pain? It started 20 years ago. It started 5 days ago. It doesn't matter. Now, people always ask me, I don't understand how this pain came about. In physical therapy, we call this an insidious onset, an onset that is unknown. What I'm going to tell you about today are the 4 primary causes of why pain is in your life. The number 1 cause is the movement pattern system. The movement patterns are described as this. In order for me to have the ability to squat, I need to have adequate range of motion in both my hips, knees, and my ankles. Now, say for example, if I have an ankle that's not moving very well, if I squat, I might shift a little bit that way. Now, if my body shifts when I squat, and most of us squat probably about 100 to 200 times a day, getting up and down from a chair, getting in and out of the car, going to the bathroom, etc. If I have the inability to squat appropriately, I'm going to create pain and faulty movement patterns someplace else in the body. So in order for us to address one of the causes, we have to look at the movement patterns. It could also be caused by repetitive strain, sitting at a computer, typing. You know, I've got carpal tunnel, I don't understand why. It could be the fact that you're at your computer for long periods of time. That's also a movement pattern dysfunction. Or it could be that you're sitting for long periods of time driving and you always get neck pain. We have to address that and take a look at that. That's number 1. Number 2, the biomechanics. Now, a lot of people don't understand what biomechanics means. Simply, biomechanics are the joints in the body. Like, for example, let's go back to the squat analogy. If my ankle has decreased range of motion, as I squat down, if the ankle doesn't have proper range of motion, the biomechanics are going to alter the movement patterns of my body. So can you see how the biomechanics can cause a movement pattern dysfunction, which could cause pain someplace else in the body? So we can look at the biomechanics in relationship to the movement patterns. Again, if my ankle doesn't move, I have to move someplace else. An analogy I always give my patients is this. Pretend like the body is a suspension bridge. And at every 10 feet you have a hinge joint. Now imagine one joint doesn't move. Another joint has to move excessively, or multiple joints do, in order to compensate for that altered ability to move. Again, if I squat, if my ankle doesn't move, all that stress has to go to my knee, my hip, or my low back. Very, very common. The third cause is the nervous system. Now, why the nervous system? Most people don't pay attention to the nervous system. I think most pain patterns are caused by the nervous system, because the nerves move muscle, and muscle moves joint. So if we're looking at the joint, if you have joint pain, say knee pain or low back pain, if we're only looking at the joint, we're not looking at what's moving the joint. So we can look at the nerve, the muscle, and the joint to eradicate the faulty biomechanics, the faulty movement patterns, as well as get rid of the tight tendon points in your body. Like, for example, have you ever had a massage before and they push on the top of your neck? And it's really, really, really sensitive, and it hurts a lot, but it feels good after they massage you, right? Now, what we have to look at is what's causing that? What nerve goes to that area? What's the faulty mechanics in that area? And then improve the movement mechanics in that area as well. It's a 3-pronged approach. If we forget one, we forget them all. That's how the body works. Now, one of the most overlooked causes is something called the Cranial Durrell system. Now, most of you are like, I never heard of that. And there's a reason why you never heard of it. This is actually the skin of the nervous system. This surrounds the nerves everywhere in the body. And we can actually get these adhesions. Well, an adhesion is this. It's basically like a stickiness that occurs between the nerve and the skin of the nerve. Remember, if nerves move muscle and muscle moves joints, then if the nerve skin is dysfunctional or not moving well, it's going to affect the nervous system, biomechanics, and then ultimately affect the movement patterns. These are the primary reasons why pain occurs. And this is part of the reason why most pain patterns don't go away. Because people often overlook the cranial system, the skin of the nervous system, the nervous system itself. Most people most therapists, chiropractors, look at biomechanics. They look at the nervous system. Most don't look at movement patterns very much. However, you need to look at them all to eradicate pain. Now, I'm not going to say this works on everybody that comes in the door, but what I will say is it works on most of the population that come in, probably 80 to 90% of the time. Our goal clinically at Kinetic Physical Therapy is to have 50% reduction of your pain patterns within the first visit. We often get, wow, how's that happening? Now, this is a rationale. This is the reason why, because there's 4 primary causes. Movement patterns, biomechanics, which is the joint, the nervous system, and the cranial Durrell system, the skin of the nervous system. Thank you so much for your attention. Please feel free to call me at 201-327-1990. Again, 201-327-1990 to schedule an appointment with one of my therapists or one of my physical therapy aides or assistants at any point in time. Thank you very much. This is Chait from Kinetic Physical Therapy.